This video discussion is about camphor and other moth repellents, corresponding to Goldfrank's Chapter 102. The learning objectives for this session are that you'll be able to name the 3 compounds that have historically been used in mothballs, and to describe the toxic effects expected from ingestion of these substances. Mothballs were very commonly used in domestic settings, especially prior to the widespread use of synthetic fabrics. There used to be a lot more clothes made from wool, and if you stored these for a long time, you'd often come back and find that the moths had gotten to them and chewed holes in the fabric. If you've ever heard of the term moth-eaten, it was coined because it was a common experience to open up an old chest of drawers or go to the back of your closet and find that your clothes had been eaten by moths. But it was found that moths and other insects could be repelled by some substances that would slowly and consistently release pungent smells. And they'd make mothballs out of these substances and throw a few of them in and around the stored fabrics. And while I said that mothballs smelled pungent, they are not necessarily very unpleasant. The odors were distinctive, but you could remove the textiles from storage and let them air out before using them. The obvious problem here, though, is that you have these distinctly smelling but not terribly unpleasant little white balls that look like candy, and that can be very attractive to small children who would ingest the mothballs. But they can even look like candy to adults. This photograph shows an individually wrapped mothball that looks just like an individually wrapped candy. This was from an incident in 2015 where they were added to a candy mixture distributed by a food bank, and the food hampers they distributed had to be recalled from needy families. Historically, there has been a progression from more dangerous substances used as mothballs towards safer substances. Mothballs had been made primarily from camphor, and then there was a transition to naphthalene, and currently most mothballs are made from paradichlorobenzene. Camphor is still found in several over-the-counter remedies for cough and cold and minor local skin ailments. The distinctive smell of mentholatum, Vicks VapoRub, and Campho-Phenique all come from camphor. And camphor mothballs are still widely used overseas, and you can purchase them over the internet, no problem. And I just learned in 2023 about another troubling source of camphor exposure from this product called Vicks VapoSteam. The product is a liquid that you put into a room humidifier, but the obvious problem is that it's sold to help with cough and cold symptoms, and the product is a liquid, and many people are accustomed to cough medicines you ingest by the spoonful. This has been a big enough problem that they'd had to put the warning, "Do not take by mouth," on the product, and yet that's exactly what the patient I saw did. And when I called the Poison Control Center about this, they said, "Yeah, we hear about this all the time." Seems like a really bad marketing idea. At any rate, camphor ingestion can cause seizures. If they're going to occur, the seizures will probably occur early, within hours, and you treat the camphor-induced seizures with typical medications. The next generation of mothballs were made from naphthalene. Naphthalene is converted in the body into oxidizing metabolites, and that oxidant stress on red blood cells can result in hemolysis and/or methemoglobinemia. The current generation of mothballs are made from paradichlorobenzene, the toxicity of which is pretty mild, and I'm sure that nearly all of you would recognize its smell. Paradichlorobenzene is the same stuff used in urinal cakes and in diaper pail and restroom deodorizers. You might get a headache, nausea, or vomiting, but someone exposed to it should get better quickly and with no specific intervention needed. Now, I don't know why anyone would do it, but there are cases of people who chronically abuse, who chronically ingest paradichlorobenzene, which has resulted in significant neuropsychiatric dysfunction and encephalopathy. So, in case you need a summary, don't eat mothballs or urinal cakes. That's it about mothballs. I'll be seeing you around.